Thank you, Mr. Speaker. First, I want to congratulate Honorable Mishiboko for bringing up this motion. Mr. Speaker, what Honorable Mishiboko is asking us as a House is that the national government, through the Ministry of Health, to collaborate with the county government to develop a policy integrating mental health care services in our health care facilities in the country. That is the motion. Mr. Speaker, how do we develop this policy of collaboration? Mr. Speaker, we must understand why Mishiboko is bringing this motion. Why develop a policy on collaboration? First, Mr. Speaker, there are very few people who understand what mental health care are. Mr. Speaker, the policy needs to be guided that we have the capacity to understand and to know the type of standards that the policy will be addressing. Mr. Speaker, there are many things that me as a person I don't know, because mental health manifests itself in the mood, the thinking, and the behavior. And that brings in the question, do we have the capacity or the ability to understand various moods, various thinkings, and various behaviors of our people? And that's why we need now to have seriously trained personnel and adequate and evenly distributed throughout the country. Mr. Speaker, these disorders interfere with the person's ability on their daily life. That's very important for us to know. Mr. Speaker, the common mental illness includes depression. It includes anxiety disorders. It includes psychopharmacology. It includes eating disorders and addictive behaviors. The question is, do we have the capacity as a nation to know and to diagnose these conditions? That's what the motion is all about. Because we cannot develop a policy without understanding why the problem. Mr. Speaker, there are so many causes of mental health, which includes but not limited to, Mr. Speaker, genetic. Mr. Speaker, it includes biological, environmental, and psychological factors. Mr. Speaker, and then we address the issue. How do we treat? How do we interfere? How do we arrest these conditions? Mr. Speaker, they require medication, they require therapy, they require support. Right from the family unit all the way to institutions. And that brings the issue. Do we have adequate facilities? Do we have facilities that are evenly distributed throughout the country? And that's why it's very important for the national government to work in collaboration with the county government. Mr. Speaker, if you walk today to any medical facility in Kenya, even Kenyatta National Hospital, they have what's called the first-hand treatment, but the continual medication and therapy can only be found at Mathare Hospital. Mr. Speaker, mental health is another entity like any other. That meaning, if you walk to any health facility, you are going to meet people waiting for you if you have mental illness. That's what the policy we are being called as a house to develop. Mr. Speaker, what is lacking in Kenya? Mr. Speaker, we have no data. The world, through World Health Organization, has said 10% of the total world population have mental illnesses. but we don't know the percentage of Kenya. Mr. Speaker, we have to do research and a deliberate research. The national government working in collaboration with the county government. Of these illnesses per region, Mr. Speaker, per age, Mr. Speaker, per gender, Mr. Speaker, per occupation, Mr. Speaker, and even in terms of family status. Because mental illness is not confined to the poor. But if we do research, we will be able how to react. So that now, if it is training, if it is distribution of medicine, therapies, and all those other factors. Because, Mr. Speaker, there are symptoms that we know of. Mr. Speaker, when you see there is a high level of suicide, which is happening right now, people shooting other people carelessly, people roaming in town without doing anything much. There are so many divorces happening, Mr. Speaker. There is a lot of fighting in families, Mr. Speaker. These are all symptoms of a society. You may think that members of parliament are very sane people, but I can tell you for a fact, some of us are mad here. In the sense that madness is not being mad, but you see the way we speak, the way we react. Mr. Speaker, that's what I'm saying.
The Honorable Elisha, what is out of order?
Mr. Speaker, is it right for the Honorable Rindikiri to indicate and say that members of parliament are mad? Is it the right language to use in a honorable house?
Mr. Speaker, I don't think I said that.
Honorable Rindikiri, order. I've heard you to say that mental illness can reach anybody, and not even members of parliament are excluded. Unless I didn't hear you right. Could you explain yourself?
It was very, I know I have as my senior on the other side, a lawyer, but I said could be. I said could be. Could be does not mean you are. Could be.
Honorable Rindikiri, you want to be informed by the Honorable Julius Unkuli?
Is my friend.
Yeah, you can inform Honorable Rindikiri.
Mr. Speaker, the Honorable Member is quite in order, because the statistics in Kenya is that out of 4 people, at least one has a mental illness. And here, Mr. Speaker, we are about 300 people.
Thank you, Mr. Speaker. Thank you for thank you very much, Mr. Speaker. Thank you, Senior, for that. I have no ill intentions whatsoever. And you know how I respect. I'm a senior. I respect everybody. I said could be. But, of course, we went to different schools, Mr. Speaker. I don't know, my friend, which school he went. I went to one of the famous schools, male school. I think he went to Nyanga Boys, sorry, for him to understand what that terminology. Mr. Speaker, on a light note.
Honorable Elisha, you are contesting you went to Nyanga Girls.
No, I didn't. I said on a light note.
I have 2 master's degrees that you don't have, one from USIU and one from University of Nairobi. I have 2 bachelors that you don't have, one from University of Kenyatta, one from Belgium. I'm sure you ordinarily went to school locally here in the country. Thank you.
Honorable Elisha, today you have forgotten the fact that from your constituency, people don't just throw stones anyhow, because the stones may hit professors. Yeah, but I want to assure you the schools Honorable Rindikiri went to are equally some of our greatest schools in the region and the country. Yeah, Honorable Rindikiri, proceed.
Mr. Speaker, what I know is that there are those who buy degrees. There are those ones, Mr. Speaker, if you go to the records of the University of Nairobi.
Honorable Rindikiri, would you go back to the motion, please?
Thank you, Mr. Speaker. So, Mr. Speaker, This motion is very critical because it calls upon us to put money, which we need to address in the policy. Mr. Speaker, we need to have facilities, and how those facilities, Mr. Speaker, would be managed. Mr. Speaker, we need to continuously interact with the international communities on various ways of sorting out this menace of mental health. Mr. Speaker, this country today, majority of our young people, and not only the young people because of the economic status or situation in the country, it is affecting our population. Mr. Speaker, as we fight drug and alcohol abuse in this country, Mr. Speaker, we must start addressing the issues of engaging our population to the mood, to create a mood of working. Mr. Speaker, some of the known causes of these problems is economic problems of our country. There are a lot of pressures in life. Mr. Speaker, the lifestyles. Mr. Speaker, when you drive big cars, and somebody else is not, people start imagining so many things. So we must start addressing the issues that most likely are going to affect our people. Equal distribution of resources, employment, Mr. Speaker, even creating a nation of entertainment. In the border constituency, Mr. Speaker, we have what we call Talanta Ella activities. We have Bore Talanta Studio, where young people today, they spend a lot of their time. They move from one place to the other one, singing and dancing, killing depression, bringing entertainment, causing laughter. Mr. Speaker, we need to be a country where people are happy. We need to be in a country where people are working. We need to be in a country where people are enjoying to be sitting together. Mr. Speaker, if we have that, then we shall reduce serious issues to do with depression. And therefore, Mr. Speaker, this policy is very important. We really need to look at it very critically. We really need to join hands together. We have looked at the areas of collaboration, and therefore I support the development of this policy in collaboration with the county government. I thank you, Madam Speaker. Thank you.
Madam Speaker.
Honorable Elisha, you know you can't raise a point of order after is concluded. So he has already concluded. Would you like to give you a chance to contribute to the motion? Honorable Elisha? No, I can only give you a chance to debate. So you have a chance to debate, Honorable Elisha. Please proceed.
Madam Speaker, thank you for giving me the opportunity to make my contribution to the motion by the Honorable Mishimboko. I think what is important for Kenya and the world over, number one, is to mainstream mental health in all our medical institutions, and also to have mental health officers in the county government so as to help us deal with the menace. But more importantly, Madam Speaker, mental health in this country is caused, among many other things, by muguka, which is a plant grown in Meru. I would urge, even as we consider the policy on mental health as exposed by the Honorable Mishi, we must be conscious that muguka is killing our children here in Kenya. And once we are aware, then we can be able to deal with the exposure from muguka. More importantly, mental health as a menace is more common amongst the rich and the wealthier of our society. And the policy then will help us edify the importance so that the wealthy of our society don't hide their children in their homes when the kids are going through a mental health process. What is equally important, Madam Speaker, what is equally important
Can I have the mic?
is to
Thank you.
benchmark.
Thank you. Honorable Elisha, 1 minute. I have a point of order by the Honorable Rindikiri. What is out of order?
Madam Speaker, the